is Liz Wolf, and today I'm going to talk to you about Ireland and its healthcare compared to the United States. So let's get started. In the United States, we've got a shared responsibility between the government, employers, and the individuals themselves. We've got a private marketplace, which is insurance not provided by the government. It includes the employer and the individual insurances that are purchased from insurance companies. The government does provide some insurances to some individuals. We've got Medicare and Medicaid. Medicare covers those that are 65 and older, or if you're younger than 65 with a disability, and this is regardless of income. Medicaid are typically provided for individuals of low income. In Ireland, their healthcare system is government funded through taxation. They also have a private services that are offered from 4 insurance companies and are regulated by the Health Insurance Authority. If you are residing or plan to reside for longer than a year in Ireland, you are entitled to the free medical coverage. We've got 2 different categories. We've got medical cards, which are a wide range of services for free, and it also includes a general practitioner's card if you wanted to just go to the doctor. If you don't have a medical card, there still are a wide range of services. They just might not be free. You might still have to pay just a little bit. For life expectancy in Ireland, we've got males living to around 80 years, which is above the European Union average of about 78 years, and females living to be about 83 years old, which is right spot on with the European Union average. The United States, for males, the life expectancy is around 76 years, and females, we've got 81 years. Expenditures for the Ireland's healthcare is about 20.3 billion euros. That's an equivalent of $22.8 billion in US money. That is 7.4% of Ireland's gross domestic product, their GDP. Their out-of-pocket payments are around 2.6 billion euros, which is 2.9 billion US dollars. As of 2017, the United States spends $3.5 trillion on healthcare, and that is 17.9% of their GDP. Out-of-pocket payments are around $385 billion. Consumers' out-of-pocket costs have risen over the years. In 1980, for example, we paid $250 a year, whereas in 2016 it was expected to spend upwards and over $1,400 in a year. For adults 65 and older with the influenza vaccine, we've got a 53.5% rate in Ireland and a 69.1% immunization rate in the United States. For the 2016 and the 2017 flu season, those 65 and older with a medical card or a general practitioner's card, around 54% of those individuals were immunized. For the childhood vaccination rates, we decided to focus on children 12 to 35 months old. In the United States, we've got a coverage over 90% for vaccination of the appropriate doses of the polio virus, MMR, which is measles, mumps, and rubella, hepatitis B, and the varicella vaccine, which is for chickenpox. In Ireland, they have a 6-in-1 vaccine, which includes diphtheria, tetanus, whooping cough, the Haemophilus influenza, polio, and hepatitis B, which 92% of children a year old are appropriately vaccinated with 3 doses by then. For children 2 years old, we've got a 96% appropriately vaccinated and 93% with the MMR vaccine. The quality of drinking water is and remains good in Ireland. We've got a microbiological and a chemical compliance of over 99%, which is good. The Environmental Protection Agency did add 77 water supplies to the remedial action list. Of those, 52 were added due to high levels of trihalomethanes. These are harmful chemical byproducts that are formed from the mixture of chlorine put in the water for disinfection and natural matter that's found in the water. So we've got some that need work, but overall the quality is high. In the United States, we've got one of the safest drinking waters in the world, with only 3 to 10% of community water systems receiving health-based violations in a given year. In 2015, however, there were roughly 21 million people relying on those that had violations. 4.784 million people live in Ireland, and roughly a third of those people are covered by the medical card, and only a little over 10% choose to go with the general practitioner's card. Many of the population decide to go with private insurance. We've got 46% that choose to go private. This could be due to aspects associated with a medical card, such as long waiting times. Sometimes it might take a while to get into an appointment with a medical card. So after all of that, we've got 11.6% left uninsured in Ireland, which is roughly 555,000 people. In the United States, we've got 325.7 million people, with 37.7% of them funded by government insurance, 67.2% with private insurance, and of that, 56 have employer-based insurance. So with that, we've got 8.8% left uninsured in the United States, which is a higher number. We've got 28.5 million uninsured. However, Ireland has a higher percentage of the population as a whole that is left uninsured. And it's a similar story with unemployment rates in Ireland. Although more individuals in the United States are left unemployed, Ireland has a higher percentage of their population unemployed, with 5.6% and only 3.8% in the United States as of 2019. So with everything that I have gone over today, I would like you to take that Ireland is government funded through taxation. We've got around a third that utilize the free health care, and although there is an option for universal health care, many of the population are drawn to the private insurances, such as the long wait times. Compared to the United States, Ireland has a higher percentage of uninsured and unemployed individuals. And as for vaccines, we have a very high rate in Ireland, with less than 5% of children aged 2 not appropriately vaccinated, which is good numbers. The lifespan in Ireland is longer, about 2 to 4 years longer than the United States, and whether those are associated at all is a topic for a different story. But a couple of things that I found interesting in my research is children in the foster care system are automatically entitled to the free health care, and vaccinations, all vaccinations and all the administration of those vaccinations are free of charge for families and children. So with that being said, I'd like to thank you for being with me today. If you have any questions, feel free to leave a comment. I'll get back to you. And thank you. Have a good day.